California children's eye care is in crisis. Can I share you by the numbers what's going on? Over 100,000 children go to school without their needed glasses, and another 100,000 plus are not getting their treatment in a timely way. This represents 4 million children in our Golden State. Almost 50% of our children are now under the Department of Health Care Services, and over 80% of the children of color. This is not just those in poor socioeconomic situations. If a working family of four, paying taxes, working hard as an independent, needs insurance, goes to the exchange, pays for cover at California, their children are put on a Medi-Cal program. They pay for that coverage. And this is an issue that affects so many children. The most prevalent visual condition is visual disorders for children. 1 in 5 preschoolers, 1 in 4 elementary school students, and 1 in 3 special education students need vision care. And this is increasing, according to a USC study. The need will increase by 26% over the next decade. Particular areas, 137% increase with multiracial, with 55% of the students that are Latinx, and that's increasing. In one study, 92% of the students needing glasses are Latinx. Let me teach you a little bit about visual disorders and their implications. This is based on the clinical studies of the American Optometric Association. A most common visual disorder for an Asian child is a number -1. That means the individual can see 20/20 up close, but 20/20 far away. This usually presents at age 8. The most common visual disorder in non-Hispanic white is +150. This means that the individual can see 20/20 far away and 20/20 up close with effort. Usually presents at age 3. Farsighted children have to work a little harder to see up close. The most common visual disorder in Latinx children is different. It's a +150 -150 at axis 180. That means farsighted with astigmatism. Their visual acuity is impaired far away, 20/50, and up close, 20/50. Vertical and horizontal lines don't focus correctly, making that all-important time to learn to read it difficult to distinguish the difference between different letters. They have the highest risk for learning and academic outcomes. Here's an example given by the nonprofit Vision to Learn, portrayed by the San Diego Union Tribune, December 10th, 2019. They were excited to present new glasses to 51 children at one elementary school because of need. They calculate that 52,000 children in San Diego County alone go to school without glasses needed. And over 95% of those have coverage through the state. Why is this so? So many children without coverage. Well, 100% of the children now have their glasses fabricated by the Prison Industrial Authority. They become the exclusive sole provider, no bids, no competition, and absolutely no choice. We have some great case studies now of what happens when the prison industry comes into a county. January 1, 2020, Cal PIA Optical comes to San Mateo County, population of 762,000. The number of willing providers is reduced to 3 taking glasses. In Santa Barbara and San Luis Obispo County, willing providers drop from 60 to 100% in different cities. In other words, the Prison Industry Authority becomes a sole fabricator. The access of vision care to children drops from 60 to 100%. And what about that customer service that you get through the Cal PIA? Before their intrusion into our county, children were receiving glasses in 1 to 5 days at our office. At the county jail I work at, inmates get their glasses from 12 to 25 days. Currently, children get glasses from 60 to 150 days through the Cal PIA system. The PIA system requires 3 times the amount of charting burden. As a result, hundreds, if not thousands, of doctors have left the system. What is the Department of Healthcare Services? It's a massive institution receiving $122 billion for this year. Of that, what do they spend on the most prevalent of eye conditions for children? 0.000144%. 14 cents on every $1,000 spent. Well, who benefits from this program? Well, the PIA, of course. They're getting $17.5 million billed to the Department of Healthcare Services and report a $6.5 million profit. This money was directly transferred from local businesses who used to provide services to fund the correctional industry. And the PIA has problems. Their labor needs are down. They reported they needed 280 inmates. Only 217 were allowed to work, a 63 inmate shortfall. And it's only going to get worse. From a high of almost 175,000 inmates, the system is down to 95,000, a reduction of 21% just in last year. So what is the state of California's vision care? Recent study showed 80% of Medi-Cal students or children failed to receive the care they needed. In other words, 4 out of 5. 21% likely to receive care than the commercial coverage. In one county, only 1 in 25 Medi-Cal children received any care. Of interest, in San Luis Obispo County, 94% of all children have glasses and are wearing glasses, according to a local school nurse and district. That's before PIA intrusion. When PIA enters a county, access to care collapses and California children suffer. So what are the numbers of, what's the impact of this on the possibility of children's future? Providing glasses, according to a Stanford study, is the equivalent of almost a year of extra academic instruction. UCLA glasses showed a significant improvement in math, reading, and quality of life indicators. Some preschool studies, uncorrected farsightedness, preschoolers scored significantly worse on ready-to-read tests. Uncorrected farsighted preschoolers had a 20% reduction on visual on-task time. Or as a UCSC study said, the long-term effects of impaired vision at an early age that can adversely affect academic and social achievements will put our future generations at a distinct disadvantage. Unequal care for half the children in our state. My name is Doug Major. I'm an eye doctor. By the numbers, under my supervision, we've done over 1 million eyes free to the state through this lowlionseyes.org. And a sister program, 180,000 eyes at preschools. Personally, I've seen 140,000 children's exams, 2,000 exams of incarcerated youth, 2,000 exams of at-risk youth, 2,050 exams to combat ready for your Army Reserve, and over 1,000 exams for adult corrections. Recently, I got a call from a local school nurse. She was concerned because after screening the kindergarten classes, 2 classes, she discovered 18 children needed glasses. I hope that you understand the type of glasses they would need and the type of demographic they would have. They were farsighted with astigmatism, the absolute worst diagnosis for academic achievement. But let's forget about the numbers. You might see numbers, but I see happy and hopeful faces, thousands of them. Please, let's fix this problem. We have many ideas for solutions. Please contact myself or the California Optometric Association, please, for the children.